Good afternoon, ladies and gentlemen. Welcome. My name is Mary Vic Aplaan. I'm a counselor here at AGI. I would like to introduce you to Anita Mehta. Anita is the Director of Education and Knowledge Exchange at the Teresa Deller Palliative Care Residence, a specialist in clinical activities and couple and family therapist. Both are master's degree study and doctoral research were in the area of palliative care and more specifically focused on the family dynamics at the end of life. She has worked with the psychosocial oncology program at the McGill University Health Center in 2007 and 2019, working with patients and families dealing with illness, life transitions, family trauma, loss and grief, role changes, distress, anxiety, and depression. She also worked as a consultant for the OMED's counseling department, working with children, adolescents, couples, and families. Additionally, she has a clinical nurse specialist in medicine and oncology at the Jewish General Hospital and currently works there as a specialist in clinical activities and couple and family therapist in the Department of Psychiatry. She also chairs the Equity, Diversity, and Inclusivity Committee at the Teresa Deller Palliative Care Residence. She also has a private practice as a psychotherapist where she sees and supports individuals, couples, and families. Anita, thank you for being with us today. So I give you the floor.
Thank you. That was a long and perhaps unnecessary introduction. I think the key piece missing from that description is the fact that I am a caregiver as well. And so I come to you today wearing both hats, that of a professional and that of a human being, a daughter who is very well versed in living loss and searching for resiliency and meaning in grief. So I really invite everyone to put comments in the chat as I'm speaking. I think people will read it out. I have received some questions in advance and I will do my best.
Sorry, Anita, actually it's the Q&A button that they have that they can write their comments. So
perfect. So I do encourage people to do that.
Yeah.
Okay, so my hope from today is that you can leave here understanding the difference in terms of the ongoing losses that can occur with a diagnosis of Alzheimer's. The participants in my hope, you can really take a look at the relationship you have with your loved one in a little bit of a different way. Now, we talk a lot about resiliency, and I often worry that that word puts so much pressure on someone who's struggling because it's really hard to even think of being resilient when things can be very difficult. I also do want to touch on the importance of caring for yourself as you're caring for someone else as well. So I like to start off with a video. So I'm going to share this, and then I'd be curious what your thoughts are, again, using the Q&A button, just to see how this hits home for you.
What time should we leave tomorrow?
I think about 8. What do you reckon?
Yeah, that sounds about right. What time should we leave tomorrow?
I told you, 8.
What time should we leave tomorrow?
We're leaving at 8, Jane.
What time should we leave tomorrow?
I think we should leave at 8.
So the reason I like to share that, and I think that was one of the questions I received ahead of time, was how do I stay patient when I am asked the same question over and over again? I think the actual wording was, how do I not lose it? And I feel that video really hits home in terms of answering that question. So before I dive into that, I'm curious if with the question button, you can indicate what type of the losses you noticed. When we talk about grief, the thing that surprises me the most is how people feel that that term is really limited to when you lose someone. So the loss is attached to a death. And then it's almost like there is permission to grieve, there is permission to mourn. In the case of dementia, the losses are ongoing. And I think that little clip really highlighted that. So there's the loss of memory, I think, which was really underlined in terms of what the clip was trying to display. But there was also other types of losses. Sometimes we're not as conscious about those. The loss of a relationship, of a marital relationship, of a future, perhaps together, that the two of them had envisioned. Losses of functionality, independence, autonomy. With every loss that we experience, or the person we love experience, there is a grief attached. I'm really surprised when I work with clients sometimes in my private practice and they start sharing their experience of being a family member or a caregiver. And I say something like, wow, you are really grieving, or this grief is really a lot for you. And they'll look at me and say, no, 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 no. My mom is still alive. My husband's still alive. And that disconnect between permission to grieve or even recognizing that the experience that they are so immersed in is a grieving process often takes them by surprise. So I really wanted to underline that in case that resonates for those of you who are caring for or living with someone with memory loss or with Alzheimer's and dementia, is that you are grieving. It's not always socially recognized, even for yourself, but you're living a grief process. So attached to that then is the importance of understanding why you're grieving. Grief is attached to loss. Very simply put, loss is the complete deterioration or absence of something or of someone. I really like this particular quote. As long as we have searched through all the tears we've cried, we have tried to find the reason for this long goodbye. This long goodbye is what we're grieving. That's our living loss. And it's multiple losses that occur over a series of time. So there's this term called living loss, and this term really became quite prominent, and we became familiar with it during COVID. Now, living loss means we are constantly immersed in a grief process, and it brings with it all the emotional disturbances, all the agony, the anguish, the sadness that's attached to grief is present as we're living loss is ongoing. Now, there doesn't have to be a physical death, and I cannot stress this enough, because the moment there's a chronic illness diagnosis, you are immersed in loss. You have just lost something. You have lost your health. You have lost the vision of how you thought tomorrow would be, even the rest of how today would be. And so the grief is immediate because the loss is immediate and the ongoing losses become imminent. So the other fact, or the other piece we need to understand, is now there is ongoing uncertainty in terms of what will happen next. Although, if you look at the trajectory of the disease, there's a certainty in terms of where it might end up. What the uncertainty then becomes is what's the timeline? And what are all those little occurrences or instances or situations that you will have to experience with your loved one? That's the real uncertainty. Sometimes there's a disconnect as well that you feel as someone either living with or caring for someone with Alzheimer's. Is this a normal experience? I get that question so many times. Is what I'm feeling normal? So-and-so isn't feeling that. Is it okay that I'm feeling that? And we'll talk a little bit about emotions a little bit later. The hard part sometimes is that the magnitude of the loss or the experience of the grief is not often recognized or acknowledged by others. It's hard for people to relate unless they're living something similar. And perhaps the most frustrating thing is this sense of helplessness and powerlessness that in and of itself can lend to a grief process.
Fancy a cuppa?
Oh, that'd be nice.
Coming up.
You okay?
Yeah. Couldn't remember where the tea bags were.
They're here.
Oh, yeah.
I'm exhausted. I, Laura, take you, Adam, to be my husband, to have and to hold from this day forward.
I know that. I know how to make a cup of tea, you know.
For better, for worse, for richer, for poorer.
I'm so sorry, Laura.
No. Please. In sickness.
Harley! You've stolen the tea bags!
That's it. In sickness. Adam? In sickness.
I want to go home.
What?
I want to go home.
And in health. To love and to cherish. Till death do us part. I do.
We vowed to help end the devastation caused by dementia. But we
So, again, I'm curious if you have any comments that you can put in the Q&A by using the button, but
There was one, sorry, Anita, there's one
yes.
actually from John Stewart. He said, like, remembering what we'll be doing when we had planned it a short time ago, losing sight of important details, forgetting themes of a series we are watching. So,
Yeah.
yeah.
So these are all early signs. The reason I like the video that I just showed is it talks about in sickness and health. It talks about commitment to somebody. And while that can be a beautiful thing, it can also be a difficult thing. And it lends a lot to the experience of grief and linking the grief to guilt. The frustration that I will hear family members say when they can't do it anymore, or when it becomes difficult, or when they get frustrated. This obligation of in sickness and health can sometimes be a bit of a burden as well. And I will address that later, because even though the talk today is on resiliency and a discussion on how to cope, I am in no way saying that you absolutely have to do this alone without support, and that it might be okay sometimes to say no. And I'll touch on that more in the self-care section. So an important term that you may have heard when it comes to looking after someone living with dementia is this idea of ambiguous loss. Ambiguous loss is a particularly difficult type of loss to navigate, and there's a very particular type of grief that's attached to it that links to this idea of living loss. What ambiguous loss is really is, it's the type of loss that we experience when the person is still there. So physically, you can touch them, you can hold them, you can hug them, but they're psychologically absent. So the person you love and that you know is physically there, but not in the same way as before. And the term we use for that is ongoing ambiguous loss, a series of different losses that you experience. One caregiver shared that the word ambiguous helped me understand what was going on. I'm still married to my wife. I love her, but I don't live with her. I've always been crazy about her, and I still am. She's looked after. But it is a huge loss for me. That ambiguity is exactly how I feel. And again, I'm curious if that resonates for some of you as well. So let's take a little bit of a look at grief now. I'd really like to highlight that grief is a unique and personal process. I have never seen or supported two people where grief looks exactly the same. The grief is uniquely attached to the relationship you have with the person you're caring for, the person that you are grieving, and it is very deeply personal. When family members ask me, is what I'm feeling normal? Is it okay to feel this? I will very rarely say No, it is not, because it is unique. Mind you, I do have the DSM in mind, and I'm clear that I'm always trying to diagnose to see if there is more help that's needed. But for the most part, grief is very normal and very natural in this particular context. I mentioned this idea of people not always understanding the grief that's attached to caring for or living with or loving someone who's living with dementia. So I thought I would kind of show the overlap that sometimes you're living multiple layered aspects of grief. So we talked already about ambiguous loss, this idea that you're grieving someone who's still very much present in your life. And sometimes that's hard to hold. But then there's also this idea of disenfranchised loss or disenfranchised grief, and that's grief that's not acknowledged or validated. So in hearing someone's caregiving experience or someone sharing a story of how difficult it was to take their loved one even to a doctor's appointment, people don't hear the grief. They often don't hear the loss attached, and sometimes that can feel very dismissive. It can feel invalidating for the person who's living it. And then secondary loss, I spoke a little bit about that when we saw the first video. What are all the other things you are losing besides the person that you love? The future, the day-to-day, the laughter, the connection. All of those things are what we call secondary losses. Even things like job, finances, if you have to take time off to be the caregiver, your role as a spouse might change, or as a daughter, as mine did. I once had a family member in a support group. We were referring to the term caregivers because as professionals, that's what we do. And he asked in the group, he said, what's a family caregiver? And someone responded to him, well, you are. And he said, no, I'm just the husband. And so I think we need to keep in mind that sometimes the roles we play change, but we don't want them to. The other thing I want to mention is how the trajectory of care changes. And with that, our responsibility and our relationship to the person we love. We often take on the caregiver role with great enthusiasm. Of course, I'll take care of you. No problem. It's my duty. It's my love. I'm always going to be present. And then things start to change. Maybe there's more confusion. Maybe there are behavioral changes and the person is more aggressive. Maybe the memory gets worse and the repeated questions keep coming. And all of a sudden, you didn't realize what you promised to do. You didn't realize the implications. And the trajectory of care fluctuates with this particular diagnosis. And that can be very difficult, where family members will often say, but I promised. And I will always say, if I'm working with a family member, never promise, because the guilt that's attached to that and then the grief afterwards is very difficult to mitigate. So anticipatory grief overlaps with ambiguous loss, and it's a term that we use quite often. An anticipatory grief, fairly evident, is the distress that people may feel in the days, months, or even years before the death of a loved one. It's the experience of carrying with you this really heavy knowledge that change is coming, and the bereavement process starts then. With dementia, the harder part is that you don't know exactly what changes are coming and you don't know what the timeline is. And that can be very, very difficult. It does present the opportunity sometimes to be able to say things or do things to your loved one, knowing that the trajectory of care can be predictable in that sense. So what do we do with that? How do we live in this space of anticipatory grief as losses keep occurring? Is it possible to mourn the future that you know is coming without actually giving up on the present? Is it possible to look at today and say, I have today with this person, I'll have tomorrow, and that might look different from today, but I can still be present? That's a lot of the work that we do when we look at supporting family members who are caring for someone with dementia, is looking at the here and the now so that they can enjoy that time, so that they can be present with their loved one. There is a progressive awareness with the seriousness of the illness. And for those that are comfortable, we do a lot of talking about coming to terms with what is going to happen. I mentioned guilt, and I'd be so curious and part of me so frustrated that I can't interact with you. But for those of you that are working with or caring for or loving somebody with dementia, I'd be so curious if grief and guilt occur in your day-to-day or in your thought process. Caregivers, family members often share that they feel guilty. And if you just look at this table, look at the percentage that think about it multiple times a day. I'm not doing enough. I'm not giving enough. I yelled at her. I'm such a terrible daughter. I should have more patience. Oh my gosh, she fell. Was that my fault? Multiple times a day, these spinning thoughts keep occurring. So given all that, if that is your experience, sometimes it's difficult to even think of yourself as resilient. Sometimes it's difficult to even imagine staying positive or thinking that things can get better. In an ideal world, can there be acceptance that things can't be changed? If you can get to that piece, then is it possible to turn your attention to what circumstances can actually be changed and focus on them? Easier said than done, right? So what are some helpful things to look at when we look at resilience and caregiving? This idea of I don't need help. Family members will often say that people ask me for help and I say, no, 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 I've got it. I will often encourage them to say, please take the help. If someone says, is there something I can do? Say yes, and then make a suggestion. Is it the groceries? Is it come over for tea? Is it come stay with my loved one while I go for a walk? You don't have to go at it alone. Perspective is an important aspect as well. Trying to look at what areas in your life you can build resilience in as well. Acceptance. This is particularly difficult. And I'll be honest, sometimes family members don't get to acceptance, and that can be okay too. Hope. I'm a big believer in hope, particularly working in palliative care. Sometimes hope changes. I don't think it disappears, but what you hope for along the way, there might have to be a refocus. So the hope for a cure sometimes disappears. And then you look for different things to hope for. I hope for a good day. I hope for a minute of connection. I hope that we can go for a walk. If you can keep the focus on hope and change the hope from a global aspect to something that's smaller, more achievable, sometimes that can be a real protective factor. And humor. A good laugh has very valuable short-term effects. Sometimes it's very difficult to find humor in situations, but it is there. It exists, and we can look more at that as well. How do you find meaning in caregiving? This is perhaps the most important factor in providing a buffer in terms of emotional resilience and psychological resilience for people that are caring for someone with dementia. And all it means, very simply put, is how do I look at this particular situation and have it make sense to me? What is the meaning that I attach to my loved one going through this? What is the meaning I attach to myself being the family caregiver? Is this a gift? Can I look at it that way? Maybe not. Is this a burden? If that's how I look at it, then that is my lived experience, but that will affect also the relationship and the grief that I will have. So finding meaning, defining it for yourself is really important. I mentioned earlier this pressure that many family members share with me about having to do this, that they promised and that there is no way out. What does it mean if you contemplate saying no? Often I'll interpret it as the person is telling me that they're tired. Maybe they feel trapped. Sometimes a family member will say, if I say no or if I say I can't, it means I failed. I have failed to be all I could be as a caregiver. I didn't give enough. I couldn't do enough. I wasn't enough. Sometimes it means I can't do what you want me to do and I feel inadequate. It can also mean I'm so tired. I just have to stop. It's important to take, if you're having these thoughts, to pause and create a time for reflection. Can you say to yourself or to your loved one, or to a professional. Let's stop and talk this over. Things need to change. But I want to underline that it never means I have failed. It never means I don't love you. This is often what the family member thinks it means and will share those sentiments, those fears, those worries that if I don't do this, if I say no, if I set up some boundaries that protect me, I have failed. And my loved one will say or will experience the sentiment of I don't love you. And that is not the case. So again, I ask maybe for a reflection as we kind of look at the different aspects of how you make meaning in your experiences. And can it be seen as nurturing? Can it be seen as gratifying in those moments if you're able to stay present in the today, as I mentioned, versus it being a burden? When family members search for and try to make meaning in their experience, there is a evidence-based link to positive psychological states, even in profoundly stressful circumstances. Exacerbations can be reinterpreted or reframed as blessings. Yes, I think caregiving gives me meaning. I'm not able to change the outcome, but caregiving has showed me that you are with them in the trenches. Knowing that mom can count on me for the best care, yes, it's sometimes frustrating and exhausting, but she's amazingly grateful, so the love on both sides outweighs the bad days. If you can't find meaning or make sense of what this is, what do you do with that? I want to underline again this really important message. You can still love, you can still care, but it doesn't mean you always need to take care. If you find yourself questioning your motives, your capacity, that's really a red flag in terms of seeking out support, talking to somebody. And I think the beauty is that the AGI, you have a wonderful network of people to talk to bounce ideas off of, to share frustrations with. How do you recognize that you're not doing so well? Oftentimes, it's someone else who might tell you, you don't look good. Everything okay? What's going on? Sometimes you may recognize it for yourself, that feeling in the pit of your stomach, the heart rate going up, difficulty breathing, panic attacks, not wanting to get out of bed. The important piece is when those things happen, if those things happen, it's important to recognize them. I had shared earlier that I'm coming to you with a mixed hat, that I'm coming to you as a professional, and I'm coming to you as a daughter who cared for my mom until January when she passed away after several years of living with dementia, and currently caring for a father who has dementia. And this idea of needing to be resilient, needing to be able to take care and managing all is quite deeply ingrained in myself. And I like to share a story, I think, that was very humbling, and I hope will resonate with some of you and encourage you to pay more attention to yourself. When my mom was first diagnosed, we had a lovely social worker who came in and was doing an assessment and kind of outlining to me what the trajectory would look like, all the changes that I could anticipate, behavioral, emotional, psychological, the limitations to the physical capacity of my mom as well. And I recall sitting there and feeling devastatingly overwhelmed as I realized what the impact of the diagnosis meant and the certainty of the trajectory and where this was going. And I started to cry. Not a graceful cry where a tear trickles down the face, but a really ugly sob. And I was crying and crying, and the social worker was rather alarmed. And she said to me, "Oof, I don't think you're doing so well. I think you need some help. I think you should go and get some help with the Alzheimer's group. They're doing this really great talk. I think you need to go. You're not coping well." And so I said, "Okay, no problem. Refer me to this talk and I will go." And she said to me, "The talk is given by Dr. Mehta. It's on guilt and resiliency for family members." And I kind of froze for a moment, and then through my tears, I said, "Oh, that's me. I'm Dr. Mehta." And she said to me, "You're giving the talk?" And I said, "Yeah, I'm giving the talk." And I think for me, that was unbelievably humbling. And it was the intersection of my professional and my personal life. And with it came the realization that I don't have it. I don't have it all put together, that I have permission to struggle. I have permission to just be the daughter in this particular context. And it really was a reset in terms of recognizing what was going on for me and accepting that all those things that I were feeling were actually quite normal. So I like to share that story because my hope is that it at least triggers a little bit of an introspection for those of you who are struggling with some of the same concerns that I was and still am struggling with. So what can you do? The first part is give yourself permission. Feel what you're feeling, express what you're feeling. There is absolutely no need for someone to be a stoic family caregiver or family member. This is hard. You're living loss on a regular basis, and you're losing the person that you love. So you're going to feel it. So it's okay to express it. I encourage you to express it. I'm a big believer in self-talk, maybe not necessarily on the bus when others can witness it, but talk to yourself. Accept support from family and from community. Can you look at basic self-care and self-compassion? Can you be kind to yourself? I often encourage a grief journal, and that doesn't have to be pages and pages of thoughts and reflections. It can just be a word or two. I had a family member once who I was working with through her grief process, and I usually give out journals to people that I'm seeing, and I gave her a journal, and I said, "Can you just use this and write down what you're thinking or feeling?" And she said to me, "No, this is a stupid idea. I don't have thoughts. I'm certainly not a writer. I don't want to do this." And I said, just take the journal. And, when you come back next week, we'll see. She came back the week after. She kind of tossed the journal at me and said, "Oh, I did the homework." I said, "Okay." And I opened up the first page and there was the F word scrawled across the first page. I said, "Okay." Next page, she had done 20 pages, just one word, and it was the same word. But I thought, this is brilliant. She took the time to write what she felt, to take out the sentiment and put it on a piece of paper. And it was one word, but for her, that word, that F word, captured her entire experience. And it was actually quite therapeutic for her. I will often suggest also to write a letter. Write a letter to your loved one. Write a letter to yourself. Put what you're thinking and feeling on paper, in an email, externalize it. Because sometimes that is the process that helps you recognize what you're actually feeling and thinking. We've talked a lot about finding meaning in the loss or in the experience. That's also really, really important. And above all, it is important to remember that it is okay not to be okay. So can you name it? Can you name the grief? Can you accept and understand that emotions are not wrong or right, that you are absolutely entitled to feel what you are feeling? Things like denial, anger, frustration, sadness, loneliness may all be experienced, and they are all authentic experiences and feelings because they are yours. Lean on family and friends. You absolutely have permission to accept help. Please deviate from the "I'm fine" to the "I need" or "I feel." Asking for help and accepting it actually takes great strength and great insight into yourselves. Can you celebrate the good? Research has shown that engaging in what we call a gratitude exercise actually decreases anxiety and depression. And what that is taking the time out of your day at any point in your day and either thinking, saying, or writing down 3 things that you are grateful for. It may sound trivial, but even something like, my mom smiled at me today, or she didn't yell at me today. Those were things that I was extremely grateful for, even though there were a lot of things that I was also very hurt by or saddened by. I was still able to find things that I could reflect and be grateful for. Self-preservation. I get very frustrated when people will say, "You need to check in with yourself. You need to check in. You need to talk to yourself." And that's great. But I also think there's value in checking out, that it's okay to tune everything out. It's okay to call Netflix a therapeutic, distractive self-care strategy. Being mindful and meditating are helpful, but can often be very difficult. It's hard for people to just clear their mind and leave all their thoughts behind. So that's not at all what I'm suggesting. I'm saying check out or check in. Both are equally valuable. Talk to yourself, reframe things, normalize things. Say yes to the things that you'd like to say yes to that you're capable of doing, but say no as well. There is absolutely no need to feel that you can take everything on. I think you all have access to the presentation, so there's this lovely routine that I'll often suggest in terms of how you can just pause for 10 minutes and take care of yourself. This is one of my favorite quotes. I've come to believe that caring for myself is not self-indulgent. Caring for myself is an act of survival. The capacity to care is the thing that gives life its deepest significance and meaning. Sometimes we don't choose to be caregivers. Sometimes we would just like to be the daughter, the spouse. But we take on these roles because we love, or we take on these roles because we didn't have a choice. Regardless of how you ended up being in this particular position, can you still find the capacity to care and find meaning in the experience? So, what I'd like to leave you with is this request, this suggestion for reflection. Is it possible to be patient with yourself? Is it possible to be patient with others as you experience the loss or you witness others experiencing theirs? So I'm leaving a lot of time for questions and discussion. And I'd like to now invite you to put your questions in the chat to see if I can help answer them. And I'm going to pull up the questions that were sent to me in advance as well. Is it okay if I stop the share at this point?
Yes, yes. I was responding to you and I realized that I was muted.
Okay.
So,
Yeah, so I'd be curious if there are people who have
so there,
questions.
well, I guess there's one she said that she just wanted to thank you. She said like several years ago, taking part in your webinar on guilt helped me to
Mm,
realize that I wanted to join a spousal support group.
mm,
That has been enormously helpful over my journey, recognizing all the losses along the way. The journey reached a turning point when my husband passed away a week ago. I'm so sorry to hear that. So the webinar couldn't have been more timely. So I appreciate the openness and insight that you bring to this subject.
mm. Thank you.
So I'd like to encourage everyone, if you have questions, please write them down in the Q&A button at the bottom of your screen. So Anita, you may address those questions that.
Yes, I'm just looking. I also see Joy. I wanted to acknowledge your sharing of emotion in terms of how this has hit you. Thank you for sharing that. Okay, so I'll go to some of the questions, but I did want to acknowledge what Joy just shared.
Yeah, thank you.
Okay. How not to, that was how not to lose it when you have to answer the same questions 30 times per day. So the frustration is very real that people have shared, and then I will see that a lot. And I'll often like to spend some time linking it to intent. We get frustrated because sometimes it feels deliberate. And if we go back and recognize that there's very levels change, but the intent isn't to ask that question. There's no conscious process in which the person can engage in to recognize that they've already asked the question. And here's where the ask is big. The ask is for empathy in these moments. And the ask is, when you feel that irritation, when you feel that frustration, can you step away? Can you say, I'll be right back? And go, reflect, walk, whatever the case, and then come back. If you go back to that first video that we saw, can you keep answering the question? But do it in that way he looked at her, with love and with affection. If you can't, that's okay too. But sometimes it's important to remember that it's not linked to intent, that there is a real helplessness for the person who's living with dementia in terms of sharing this. And as frustrating as it is for you, it's unbelievably confusing for them. We talk about this process called mentalization, and that's really trying to think and understand how someone else is thinking, and also how you're seen in the moment by that person. And the thing with dementia is you can't do that. They can't do the empathy toward you piece because they don't understand how you're thinking and feeling, because they don't understand how they're thinking and feeling. So sometimes that helps a little bit in terms of how to cope with the frustrating questions or even the aggressive behaviors. Um, at the same time, it's okay if you lose it once in a while. It's okay if you get frustrated. It doesn't make you a bad daughter or spouse. It doesn't make you a bad person. It makes you very, very human. And again, I can share an example of, I remember when my mom's behavior started to change. And at one point she had kind of tripped and fallen. And when I went in to help her, she pushed me away and she said, "Why did you push me? How could you push me?" And I remember the physical feeling of frustration and anger and indignation. And I said, "What are you talking about? I didn't push you." And went into a bit of a rant myself, and to the point where there was a little picture that I had drawn her as a child where it said, "I love you, Mommy," or "You're the best, Mommy." I can't even remember at the time. And I remember taking it and saying, "This isn't true. You're not a great mom," and scrunching it all up and putting it in the garbage. And let me tell you the shame and the frustration and the guilt I felt after that. And looking back, I wish I had just taken a deep breath and said, "Oh, that's her dementia speaking." But I couldn't, I didn't. And I share that example because I want to highlight the humanness in all of us. I want to highlight that we're not always going to be able to be the best versions of ourselves, because there is an accumulation of loss, an accumulation of frustration. And sometimes that just has to be okay. Are there other questions? Or do I read off something else? Someone is making reference to caregiving issues not being addressed by the care team or services offered, and that they had to seek support after. Again, great point. And another source of, I guess I'm a frustrated person, another source of frustration for me as well, is how family members are not looked at or asked how they are doing. Which leads to the high incidences of caregiver burnout that we are seeing. And so the unfortunate piece sometimes is the advocacy piece, is needing to say, "I'm not doing well," or "I can't do this," or what help is possible. Linking up with community resources such as AGI is absolutely essential, and sometimes the link between sanity and burnout. And the fact that people will refer or seek grief support after the person is deceased, that is fantastic, but it shouldn't wait that long. We talked about anticipatory grief and how that can actually impact grief in the bereavement period in a really positive way. That is the time to seek support. That is the time to connect with people, so there is ongoing capacity to cope with all the changes that are coming. Are there other questions? Caring for yourself, how when one has to do the work of two people and process loss of life as we know it, it's very hard, yes. And I think if we can challenge what caring for self looks like, sometimes that can be helpful. It doesn't have to be a complete disconnect. It can be closing a bathroom door, taking a deep breath. It can be an audiobook. It can just be that checkout I talked about, even if it's for 10 to 15 minutes, just the soothing of your your ANS, your autonomic nervous system, just that can decrease your cortisol levels and your stress levels and give you a moment to recalibrate. So I absolutely acknowledge, recognize, and have lived how difficult it is to care for yourself. And I think if we can redefining caring for self as a momentary checkout, then that can sometimes be okay as well.
Anita, there is this one that I actually just sent by email. She says that I don't feel grief will ever end Tried
Mm.
grief support groups, received no concrete help or tips. What can I do to grieve her father's passing? And now she is also a caregiver for her mother, who's also diagnosed
Mm.
with dementia.
Mm. How long ago did you experience the loss? Do we have the answer to that, or
Yeah, hopefully no.
no? Okay,
Mm-hmm.
I can still address the
Mm-hmm.
question. So the thing about grief is it's not meant to end; it's meant to change. And anyone who comes to me who asks for closure, I will say you are with the wrong therapist. Grief is meant to be integrated into your life. It's meant to sit there as a reminder of the relationship, of the intensity, of the love that you felt. So, what happens over time? And I don't know if this resonates. And my email, I think, is at the end of the presentation, but anyone is welcome to email me if you want clarifications. The size of the grief doesn't change. It's your life around it that expands. And I didn't have that particular slide in my presentation. But it's not meant to disappear. It's meant to feel differently over time, where maybe early on you may have a memory or a thought and it brings a flood of emotion, and then there are tears, and then there's frustration, and then there's anger, and that's okay. Maybe you think of the same thing 6 months or a year later and you still feel a surge of emotion, but maybe it's a sigh, maybe it's a smile, maybe it's still tears. But how you reflect on the memory is what's meant to change over time. So I don't know if that resonates for you, but the goal is never, at least in the work that I do and from my perspective, to have the grief disappear. It's really to have your life kind of change and revolve around the grief, because the size of grief, it doesn't change. It's like you carry it in your pocket. There's another analogy where it's always going to be there. It's in your pocket, and you go about your life, and once in a while you put your hand in your pocket and, oh, wow, it's still there. And that's okay. So I don't know if that answers the question, but I think my take home message is that grief isn't about closure. That is not the intent, because that means you close the relationship. And how can you possibly do that? Now, if the grief that you're feeling is interfering in functionality, if it is stopping you from doing things, if you're overwhelmed with emotion and you're incapacitated by it, then please, I would say that perhaps is where we kind of look into, and I didn't really want to talk about it, but you look at prolonged grief disorder, which is a category under the DSM and is something that we treat more seriously. Um, it's not uncommon to feel depressive symptoms as well. And so I'm constantly on the lookout of, where's the overlap between depression and normal grief, or depression and prolonged grief disorder. So that is a real thing and a possible complication. But just the mindset of grief should disappear is just what I'm trying to challenge a little bit. So I don't know if that helps
Yeah.
the participant.
So is that what you're just referring, Anita? Is that like also what I usually hear people say, complicated grief, or?
Yeah, so more recently, the DSM has reframed it.
Okay.
So what was complicated grief is now prolonged grief disorder. It's just a change in, it's a change in what we're calling it now.
So I have another one in here. This is from Katerina. After the last hospital stay, ICU told me he could not come home. I guess this is her husband, meaning I cannot hold the 3 shifts on my own. He is in a transition residence. We're not adapting well. I am in full burnout. I wanted to bring him at home with other family members for a few hours. We were all very happy, but now he asked me to come home every day. Does not understand why not. Do I continue to regularly, I guess, bring him home, or what can I tell him? What is your take on that?
Yeah.
Yeah.
So the answer to that is based on your capacity. Can you bring him home in a way that is feasible to you? It comes back to obligation versus what we're actually capable of. And how do you interpret the meaning of, I can't bring him home every day? And then there's the, I don't want to bring him home every day too. And I wonder if that thought occurs as well. And are you okay with that thought? So that's a convoluted answer to it. Really depends on your own capacity, because if you burn out, if you crash and burn, then he loses a caregiver who he needs. And so things you can say, now again, it also depends on the degree of memory loss and cognitive functioning. So I don't want to generalize, but sometimes the not today, but on this day. And now if they can't grasp that, that might be a good thing or it might not be a good thing. And again, it's hard for me to give this suggestion without fully understanding the cognitive aspects of where the person is at. But simply put, if you don't have the capacity, then it may not be the right thing to do. It might be a tapering of visits. It might be someone else having to be there with you. I also don't know what the transportation looks like. If it's you and then there's that additional burden or difficulty in getting the person in the car and getting them home, can you look at transport? So I really would need
Contact.
more context to answer that. But again, the bottom line is no, it's not an obligation if you cannot do it, because you simply can't. And it's okay to not want to. Saying no doesn't mean you don't care. Saying no doesn't mean you don't love. It just means you simply can't, and that you're looking after yourself and setting healthy boundaries so you can continue looking after the person that you love, even in the face of anger or frustration on the part of that person. So I hope that answer helps.
Yeah. So there's also another one in here, Anita. My husband has been in long-term care for 5 years and had major medical issues at the same time. I go daily and want to be with him as long as he knows me. Description of the loss and grief is right on for me. So where does one go for individual help to cope with the losses? Yeah.
Hmm. So different suggestions. I know, and maybe you can speak more to the resources that are available at AGI, but that is a fantastic place to start. I would love to recommend the public healthcare system in terms of individual support, but the wait lists, unfortunately, are quite long. Private therapy as well. I highly recommend being a psychotherapist who works specifically in this area. Some therapists have sliding scales. As I said, I'm happy to try to answer some questions if people would like to send them my way. When should you seek help? The moment you feel you need it. And I would say even from the moment of a chronic illness diagnosis, start your support network. Start to look for the people that you can speak to and that can relieve you, because that's really important.
Yeah. Yeah, so here at AGI, we are here to also help you. We have our sessions, our counseling session is always, regardless of where you're at the disease, what kind of caregiver you are, we're here to help you navigate it and help you find resources as well at the same time. So, it's we really believe that it's having dementia is not just the it's not just the responsibility of the caregiver, it's a community that we need in order to make things matter. So, yeah. Okay, so I think this is the last one, the way I see it. One is saying that my husband is very negative. So I'm assuming that the husband is the person with the diagnosis. He just tells me, accept it, and it's only going to get worse. Very negative. Any ideas? So,
Yeah, so it comes back to, is he wrong that it's going to get worse? But we could talk about acceptance. Now, I've never been a big fan of the stages of grief, because that outlines a very linear process, right? Where you eventually beautifully get to this place of acceptance. But you don't beautifully get there, do you? And there's been a lot of reworking through that model. And I come back then to your own thoughts and feelings of, how are you making sense of this? What is the meaning of the diagnosis? And what does it mean to accept it? Does it mean you're powerless? Does it mean you're helpless? What's the meaning that you attach to this? In terms of dealing with him, again, I don't know what his cognitive processing is, but I can guarantee you arguing your way through that probably isn't going to be helpful. And so I come back to the strategies of normalizing and validating. Yes, this is really difficult. Yes, this is going to be hard for both of us. Yes, I see there's so many changes. Yes, I'm feeling frustrated. Yes, you're feeling frustrated. So the validation piece puts it out there of how real the experience is, regardless of whether you accept it or not. You don't have to accept it in that particular moment. So the validation is probably the best strategy.
I agree.
Yes, I agree. I see it. It's real. The other thing that I sometimes like is what I call the 3 Ws: wish, worry, wonder. I wish things were different. I worry, though, that things are going to change a little bit. I wonder if we could talk about that. And I use that all the time in different contexts because the I wish is that little piece of hope, right? The I worry is, can I please insert what what we need to look at? And the wonder is, can we start a conversation about it? So the 3 Ws for me are, every time I do a communication workshop, I really stress the wish, worry, wonder, because that can be very helpful in communicating.
Is there an association of therapists who specialize in grief and bereavement that you can recommend?
An association, not necessarily, but I certainly have therapists that I will refer to. You can also go on Psychology Today, the website, and put in the expertise that you are looking for, and that's very helpful. I know here at the palliative care residence, and this is post-death though, we have amazing support groups for grief and bereavement, and the person doesn't have to have passed away here at the palliative care residence. Our bereavement groups are open to everybody in the community. So you can just go on our website and look for the groups. We have a bereavement coordinator here, and that can be extremely, extremely helpful as well.
Okay. So I think this is the last one actually. Anita, can they book a therapy sessions with you?
Sorry?
Can they book therapy sessions with you?
They can certainly reach out, and I can have a conversation with them. I have a pretty long waiting list, but I try to prioritize in terms of urgency and what the need is. I will always try to redirect as well. I can look at sliding scale versus not, but I don't always have one. So let's talk. So please give my coordinates. I'm absolutely happy to see if there is a way I can support you. And if not, then I will try to redirect you to another resource. It really depends on urgency because of my waiting list and the fact I don't have any openings right now. Yeah.
Anyway, Anita, thank you very much for that very, supportive, really, and enlightening presentation about like really understanding how grief is hard with the onset of the disease and as you go through ambiguous loss and everything. I think one of the things that I also hear from families is that sometimes they feel, is it normal to feel detached sometimes after all those years of giving, how do you say this, giving care? And I have one caregiver who's saying, at the beginning I felt the grief, but now I just feel so detached and I feel so guilty about it.
Yeah.
Have you, yeah,
Sometimes detachment is self-protective,
that's what I
right?
thought. Yeah.
And that can be okay.
Mm-hmm.
I'd be curious if the numbness extends to other areas of life, though, right? Like, are they cut off from feeling in different areas of their life? In that case, I might be a little bit more concerned.
Sure. Okay.
So I would do more of an assessment piece. But the numbness sometimes can be linked to anticipatory grief because you have been grieving for so long that you're all grieved out. And that can be okay. That can be normal as well.
Okay. Thank you
Yeah.
for that
You're
clarification.
very welcome.
Okay.
Thank
Thank
you for
you.
having me. As always, it's a pleasure.
A pleasure. It's our privilege to have you as well. So thank you. So, ladies and gentlemen, if you have any further question, please just don't hesitate to reach us here at AGI. You can call the number 514-485-7233 or email us at info@agiteam.org.